Hi, Aman. Aman, are you there?
Yes, sir.
Yeah. So, what's happening to your registration in Azerbaijan?
Yes, sir.
Yes, sir. You started?
Not yet, sir.
Not
Actually,
yet, actually.
I was working on the from where to proceed, and the product that we were working was the dental products, dental composites.
Acha,
So,
acha.
because in MDR, Indian MDR, it is Class B product, and just like we need to get it confirmed, can we get those product in their Class 1 and get only the product registration done? And what will be the procedure? So slowly we are doing R&D on it. Still it is under R&D. We haven't yet
Acha.
did it, but yes, we are in discussion.
Okay, I mean, what is the intended use of it?
Sir, it is rinsing, sir, rinsing products like uh, used to help the products. If you see the dental composite, sir, the intended of use will be uh, to make an artificial teeth, or to make to rinse the teeth after the procedure. Some are
Okay.
composites and some are solutions.
Acha. I think then it will fall. It's Class B in IMDR, no?
Yes, in Indian MDR it is in Class B product.
Yeah, either it will come in class 1 or class 2A. I'll check it out. Because it is an R&D stage, I don't want to ask more information. Uh, but just the intended use, if we can, if I know the intended use. Uh, but why you have gone to Azerbaijan instead of other countries?
Actually, sir, the company has like a contract to deliver those products, and I think maybe they have to send the consignment around April, or maybe on from after April, after I think financial year. So they said just go through the details and how much will be the timelines, what will be the total workload on it. So based on that, we will take a decision. So we thought okay, चलो देखते हैं क्या क्या कर सकते हैं from our end.
Sure. अब पैरेलली आप रेगुलेटरी डॉक्यूमेंटेशन भी कर सकते हैं इसमें.
हाँ सर, वो तो कर सकता है.
Yeah, just I'll check in my database because I done for this dental products for Prevent Denpro. It's
Prevent.
in Jammu.
Yes,
Yeah.
Jammu, Jammu. Sai Kalyan sir.
Yes. Yeah, I worked for some time there.
Okay.
There is one in one dental product. I mean, that's there in Vadodara.
They have 3D printers and the solution for 3D
Yeah,
print.
they have this. This Jammu plant have this 3D printers. They are very advanced.
Correct, correct, sir.
But there is one more which I worked is in Vadodara. It's Green Apple, something like that.
Green?
Green Apple.
Green apple, yes, 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 sir.
It's in
Uh,
Vadodara.
Vadodara based company, correct, correct.
We have done 510K for them.
Okay.
So I'll check in my database like which category it falls.
Mhm.
Mainly in UMDR. I know like in 510K, I mean in US it comes under 510K.
Okay.
EMDR, I'm not sure. Either it comes in class 1 or class 2A.
Mhm. So,
But if it comes under, yeah. See, since I mean, you can also, yes, you can also go for, say, if it is 510K exempt,
Mhm.
just you can go for only facility registration and listing. There won't be any charges. Only facility registration, which will cost somewhere around 5.5 lakh.
Mhm.
Then listing of the device.
Okay.
Uh, yeah, it doesn't cost much if it is exempt from 510K.
Okay.
Then for Europe, I know like if it is class 1, if it falls under class 1, non-conform, I mean conformity assessment will be very simple.
Mhm.
But if it falls under class 2A, then
Mhm.
we need to do some technical, not so lengthy, but some technical documentation like the quality management system, mainly the PMS thing. Okay, not much on in-depth on the clinical.
Mhm.
It will be basically on risk-based usability.
Mhm.
I think so. I mean, some parts of Annexure 1 and Annexure 2. That's Annexure 1 is GSPR, 2 is technical documentation. It
Okay.
will be easy. I mean, documentation for class 1, class 2A will be very easy. But to dental products, no?
Mhm. Sir, one see my hand-on experience is more on Indian MDR, and rest is like there are still certain fog between like in which case there is an on-site audit, in which case there is only product registration, and what to just to make it a simple procedure. Okay, step by step. Okay, if this country is there under this, and here where we need to put our registration. If that pathway or a flow chart will be, sir, much. You know?
Yeah. I'll share it for Eurasia. Eurasia means it also includes Azerbaijan. But important thing, Aman, is like if you have, I mean, since you said like you already have some contacts in that country,
Mhm. Yes, yes. We
okay?
have an AR, authorized representative we have over there.
Yeah, then that becomes very easy.
Okay.
Okay, then you need to have a free sale certificate to export them,
Mhm.
and basically you should have the enough. I'll share with you what are the list of documents, like the administrative documents,
Mhm.
mainly the agreement between the authorized representative and the manufacturer, ISO
Mhm.
13485.
Mhm.
Okay, some documentation on 13485 and also the certification.
Yes.
Uh,
No, we
Power
do
of
it here in form of MD 14 and 15, sir. For
Yeah, you can do it. Yeah, here only you have to do it. And power of attorney, here only you have to do it. Power of
okay,
attorney to the authorized representative.
okay,
FSC is also you can do it here.
okay.
Uh, these are main important things. Other documentation include the QMS like the quality
Mhm.
manuals. Okay,
Mhm.
basically the quality manual. They won't ask everything in detail. They
Okay,
ask the summary of the QMS. That's a quality manual.
okay.
Okay, if they ask something on some clause like on clause 6 or product realization, clause 7 on product realization, clause 8, they may ask.
Okay.
Okay, and you need to also cater to some on your PMS, not on PMCF, because class 1 doesn't require PMCF
Mm-hmm.
or clinical follow-up. It just like customer feedbacks, uh, complaint handling, CAPA. Okay, in that particular country, if there are some issues, you need to have procedures, that's all. Like
Mm-hmm.
SOP you should have how you will handle it. Okay. And as for the biocompatibility studies are concerned, I mean, since I don't know much about what are the composites and uh, where there are any leachables that come out, you need to work on that. Any
Mm-hmm.
extractables or leachables that will come out after you do the rinsing or the composite is deposited on the teeth.
Okay, okay.
Any leachables come or it causes any irritation. I think sensitivity irritation is important. Extractables and leachables are important. Of course, cytotoxicity, all that is
Yes.
part.
Yes.
Yeah. Maybe three, four things will come in for biocompatibility.
Mm-hmm. But sir,
Yes.
eh, like what I have seen is here what happens is if the raw material if we are procuring from let's suppose any principal company and they have already got their biocompatibility or
Yeah,
cytotoxicity.
yeah.
Okay, so the same report
Yes.
can we submit against the product and we can, skip that part because, when biocompatibility, if we are going to go for a lab, it will cost us around 4 to 5 lakh
Yeah,
rupees.
it will cost a lot, I understand, but you can give one thing is if your composite where you are procuring already has the biocompatibility studies,
Mm-hmm.
and what is the next step you are doing in your R&D? Are you mixing with something or is it as it you are using them?
So basically, sir, what happens is mostly the mixing, packaging, labeling, and dispatch. This is the procedure right now. So,
Mixing your, I mean, if it mixes that composite mixes with any of the solvent, uh, it will change the composition or the chemical characterization.
no, sir. Mostly all the composites are going to be same. It is just that some some have different weights and the kind of like there are certain 2 file, 3 GM file, 5 file. So based on that, they fill it. They after that they package it, label it, and then dispatch it, sir. Mostly that part.
Acha, see, point one, as I said, is if it is not going to affect,
Mm-hmm.
if your composite is not going to affect after mixing with the resin, you can directly support it with the biocompatibility studies of your vendor, supplier.
Mm-hmm.
If it is changing, if the chemical characterization changes,
Okay.
then you can only do the chemical characterization.
Okay.
Then prove that before and after mixing the solvent, there is no change in the chemical composition or characterization.
Okay. Okay.
Okay, any method you do, any analytical method, not in animals, any analytical method you can show. See,
Mm-hmm.
this is the composite, what we got from the vendor supplier, and this is the final one which we are using.
Mm-hmm.
Okay, do chemical characterization and show that there is no difference.
Mm-hmm. Mm-hmm.
That way you can avoid a lot of, totally biocompatible studies you can avoid.
Mm-hmm.
And
Okay.
second option you have is, if you have something like a predicative or a competitor who has done similar things like you,
Mm-hmm.
okay, some what we call predicative. You can look into that predicative and see what is their composition,
Mm-hmm.
and just you need to test both of them, your composite and their composite, again chemical characterization.
Okay.
If both are same,
Mm-hmm.
then there is no need of doing biocompatibility studies, because the CPCA guidelines or the biocompatibility guidelines clearly say that there should not be any repetition of studies on animal models if it is the same.
Mm-hmm.
That will cause repeatability or redundance of the study and killing of more animals. That is not accepted as per the CPCA and the lot of other guidelines.
Okay.
So the first option is better, like you show like from the manufacturer what you got, and after mixing it doesn't have any change in chemical composition or characterization.
Mm-hmm.
Okay, I don't know like whether you do DSC or any analytical method.
Sorry,
If I
sir.
know the concept, I can tell you like what could be the analytical method.
Okay. Okay.
And second option is like compare it with your predicate to do chemical characterization as per I think 10993 part 13 something is there.
Mm-hmm.
Then there won't be any issue. There is no need of conducting biocompatibility again.
Okay. Okay.
If the chemical composition is same,
Mm-hmm.
okay, there is no need of doing the biocompatibility studies again.
Okay.
Okay, and you can, provide technical equivalence, biological equivalence, okay, even the equivalence and other things easily, like the only thing that comes is on the uh, risk management and PMS.
PMS. Okay. Okay.
PMS, you need to provide the procedures only.
Procedures
How
only.
you are going to collect, how you are collecting the PMS data, whether it's you have a procedure for customer feedbacks, you have a procedure for collecting, complaint handling,
Mm-hmm.
PMS for SOP for COPPA,
Mm-hmm.
root cause analysis, and subsequent registers for them.
Okay. Okay. So,
Because it's fast, yeah.
so sir, let's suppose there are certain, like, is there first thing is there any list I can get for the classification based on the other, or should I, or do we have to follow the EU MDR classification of medical devices or something like that, sir? The same we have for
It's,
Indian MDR.
yeah, you can follow UMDR classification. That's mostly accepted in even other countries also.
Okay.
Because, yeah, I know like a lot of countries follow not only the classification like UMDR, most of them follow the documentation structure like the UMDR only.
Okay.
Like the SFDR, Saudi or UAE, They say that if your documentation is like EU MDR, that's fine. They don't have any specific things to add because EU MDR is such a big, complete package. Okay, it covers everything. So your document, if it is almost similar or same as that of EMDR, then absolutely you won't have any problem.
Okay, okay. And sir, one more thing, like what I basically follow is there are three things that I make sure before initiating any regulatory process. First is the product. Okay, I take the product, work on the classification, get it corrected. Second is the premises. Okay, what is the premises we have? What addresses we need to get it done, and what are the supporting documents? And last is the process. What is the process that currently we are following for the manufacturing of that product? Once
Yeah.
these three things are finalized, we initiate the regulatory process. Okay.
Yeah,
Now,
that's
our first step is to get the product to the Azerbaijan. For that, we have an AR. Second,
good.
now what will be the next step is going to be the application fees, the AR,
Yeah.
everything. We need to get it done. So
Yes.
this is what I usually follow for any application if we need to proceed. But now here the thing is, I am not aware about the other application procedures. Yes, I am aware about the terms 510K. I am aware about the terms UMDR, but how to, go and work and see the procedures for those, sir?
For the particular country, for that Azerbaijan,
Yes, yes.
see, I said no, there won't be any change in the documentation. I mean, any medical device have that same pattern of documentation.
Mm-hmm.
Okay, once you see, one is since you have an authorized representative in Azerbaijan, once you fill the application,
Mm-hmm.
okay, that authorized representative will tell you what are the documentations required.
Okay.
Okay, because there the I mean the regulatory authority will tell you for class, if it is class falls in class 1 or class 1A, they will give a list of documents. Of course,
Okay.
I'll also maybe tomorrow I'll share you what could be the list of documents they may ask.
Mm-hmm.
But basically, I have the list of documents that are required in total Eurasia,
Mm-hmm.
I mean, I mean Eurasian Union.
Okay, okay.
So that same thing we can follow.
Mm-hmm.
But the point is like you should start documenting the rest. I mean, you should give responsibilities to authorized representative that you fill the application, pay the fee, and you need to do what are from your side, like giving power of attorney to the authorized representative.
Mm-hmm.
Okay, the agreements, pre-sale certificates.
Mm-hmm.
Okay, and then start with your classification.
Okay.
Check where which classification it falls and what are the documentation. Of course, you'll have all ISO related documentation.
Mm-hmm.
Mainly the regulatory documentation matters.
Correct, correct, sir, correct.
Yeah. So that I mean tomorrow, day after tomorrow, I'll provide what are the administrative documents and what are the
Mm-hmm.
regulatory documents required. But I
Oh.
said no, to my conscience, it could be only 4 or 5 documents that are very important.
Mm-hmm.
And of course, back compatibility is important, but how to circumvent that back compatibility studies, we should find some options.
Mm-hmm. Okay,
Okay, and then conformity assessment will be similar to what we do in MDR.
okay,
So
okay,
these are the regulations we followed, and we say that it's safe to use for that particular intended purpose.
okay,
Okay, and yeah, I'll share a list of documents tomorrow, both administrative and the regulatory. I mean, the QM quality part, administrative part, quality part, and the regulatory part. there will be three sections.
Mm-hmm.
Administrative part is more like your agreements with authorized representative,
Mm-hmm.
power of attorney.
Mm-hmm.
Okay, these are all written agreements,
Mm-hmm.
pre-sale and other things, and the application. These are administrative things. The QMS quality part is linked to your ISO 13485.
Mm-hmm.
Okay, basically they ask only certification. In case if they ask something on uh, product realization or manufacturing process, of course they ask the manufacturing process
Mm-hmm.
from QS or your plant or site master file.
Mm-hmm.
Manufacturing process both in sentence and in flowcharts laws, and
Mm-hmm.
list of raw materials, list of suppliers. Okay. Uh,
And sir, may I know like how much difference if I have to compare the Indian MDR compared to any other EU procedure or application, regulatory application, how much is the difference, sir? If let's say I have a strong holding on this segment and I can initiate the other application by myself or like
yeah,
there.
you can do it. I'm pretty sure you can do it
Mhm.
because one thing is, to your first question, if it is in class 2B or class 3 device, there will be a lot of difference between IMD or Indian regulations and European regulation
Hmm, hmm, hmm,
based on the risk class
hmm,
or
hmm.
class 3 or class 2B. But since we are talking about a low risk or moderate risk, there
Correct.
won't be much difference between IMDR and other regulations.
Okay, okay.
Okay, there will be more focus on your manufacturing process, raw materials, suppliers, supplier agreements. Okay, the supply chain, and as I said, risk management is the key,
Mm-hmm.
and PMS is key, and we need to work out on the strategy on biocompatibility.
Okay, okay.
Okay, that will be the main things.
Hmm, hmm, hmm.
Coming to the regulatory part, it also includes, as I said, now we need to fill the GSPR.
Hmm,
Okay, technical documentation, not all sections, some sections of the technical documentation.
hmm.
Okay, which also includes what I said before on usability engineering, how it will be used. That will be very important.
Hmm, hmm, hmm.
Okay, how you need to mix it, the directions of use, how you need to apply on. So that usability will be what we call human device interface. That could be important, and of course, risk management, biocompatibility, and PMS.
Okay, okay. And sir, like apart from this, there are two more things. First is your C where we have low end devices, low high voltage devices, LMV. What? And second is high voltage devices. There are two,
Okay.
correct?
Yeah.
So in that, in the class one products are that for the mechanical products. So in that only like technical file review is there, right?
Yeah. Technical file, right.
Hmm. Answer while selecting the notified body, because I have seen way much difference between mostly on the commercial part when it comes to selecting a notified body. There are bodies who are charging around I think 7 to 800 $8,000, and
Yeah. See,
second
like, yeah, but
and second is I have seen like companies like Czech Republic are there, they are charging around 1300 $1,400 approx. So in terms of commercially to make a decision, sir, how to select a notified body, my end question is going to be.
see, it's like there are some notified bodies where you can, I mean, the time is important. Time period, how they get, how fast they can get the registration. See, there will be some notified bodies which take a lot of time to get the product registered. okay, and charge less.
Hmm.
But on contrary, it's opposite. Like there will be some notified bodies which charge more
Hmm.
and get your product registered very, very fast.
Okay.
Okay, the difference is those notified bodies which do this registration fast, they will have a good technical team or number of technical persons will be more who can review it, okay, and take decision.
Hmm.
So that will, I mean, incur additional costs,
Okay. Okay.
but it will be done fast.
Hmm. Sir,
I can
example.
do it in 3 months, like.
Sir, example.
Yeah, there are like, I mean, of late, I don't know like how they are engaged. Most of
Hmm.
them are engaged with EUMDR because, there is a lot of changes that are happening
Hmm.
in EUMDR also. But
Hmm.
here the point is, since you have, I mean, I'm talking about only Azerbaijan, since you have an authorized representative there,
Hmm.
he can directly apply or he can directly submit the documentation for you.
Okay. Okay.
Only there will be registration fees,
Hmm.
okay, application fee, registration fee.
Okay.
The rest documentation, because you are doing it,
Hmm.
he can review the document if he has knowledge, or you can give it to somebody who can review the documentation,
Hmm.
then submit.
Okay.
Okay.
Hmm.
So, I mean, you should make use of the authorized representative to submit your documentation directly to him,
Hmm.
directly to the regulatory body in that country.
Okay.
Okay, that will become still fast because he will keep updating you or he will be meeting the regulatory authorities every week to know the
Hmm.
status.
Hmm.
So there will be a regular follow-up.
Correct. Correct.
Okay, in-person follow-up is always better.
Always better. Even in
Yeah.
India, sir.
Otherwise, I mean, if you depend on the emails and all that stuff, it will get delayed.
Hmm. Correct.
So
Correct.
you have to make use of the authorized representative to do your documentation perfectly,
Mm-hmm.
get it reviewed, and
Mm-hmm.
submit that to authorized representative so he can, I mean, directly be in contact with the regulatory body there. Okay,
Mm-hmm.
get the application form done, get the registration done, whatever may be the fee, and
Hmm.
let the authorized representative submit your documentation.
And
Okay,
sir, in
yeah,
case,
this is what we do in other countries. Like when there is an representative, authorized representative, he will directly submit it.
okay, okay. And sir, let's say we don't have any AR. Let's say
Yeah,
if we need to submit some South African countries. Okay. Well, maybe Zimbabwe is there, Utopia is there, or maybe some the countries, very where we need to get it product done. We need to sell our products. We don't have an AR. So in that case, what will be the situation, sir?
yeah. See, it's a very good question. Like in some countries, like in most of the countries, it's mandatory that you should have an uh, citizen of that country to be an authorized representative.
Okay.
Okay, in some countries.
Okay.
But in some countries, there are organizations where they can appoint authorized representative. Like you have Freyer in India, or there are some consultancy companies.
Hmm.
Okay, where they will appoint authorized representative on your behalf.
Okay.
Okay, we need to pay fee here. So
Hmm.
that guy will take care of everything.
Hmm. Hmm.
Okay, suppose say like when we have done for the West Asia, like in Europe, sorry, in Saudi or UAE.
Hmm.
Okay, I mean, we didn't have, but I have some contacts there
Hmm.
where she is a citizen of Saudi,
Okay.
and she was in medical devices.
Okay.
Okay, and we appointed her as authorized representative.
Okay.
Okay, And the second scenario is like in some countries, of course, I mean, we try to have that some products registered in Iran,
Mm-hmm.
but that not was possible because Iran was, I mean, not in European, recognized by the European Union.
Okay.
So for some countries, we approached these consultancies, mainly very good consultancy bodies like Freya, which
Mhm.
has, I mean, representatives worldwide. Global representatives are there. Globally, they have representatives.
Okay.
So we need to pay them
Mm-hmm.
for appointing for also the duties uh, that the authorized representative will be doing, like submission of the application and the documentation, the reviews, if there is any NCs or queries, that
Mm-hmm.
will come to the authorized representative, which will be passed on to the manufacturer.
Okay. Okay.
But officially, the agreement will be with the manufacturer and the authorized representative, not with the third party consultant
Consulting company.
who is facilitating this.
Correct. 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 And sir,
Okay.
if as you said, you have some like connection in Saudi, one of your friend is there. Okay.
Yeah, yeah.
So if like, is there any like they should have an office, they should have a
Yeah,
warehouse,
they have an
or,
office. Actually, they
or
were involved. Yeah, they have a registered office. They are a registered consultant because actually, she was my student. I was teaching to them. She studied in Shadhan College here only. And I know her, like, but after marriage, she went to Saudi. There we settled and they got a registered. They need to have some warehouse, okay, for storage of our
devices.
uh, devices, and they should have a registration with the country. Okay,
Mm-hmm.
but but the authorized representative in Saudi can also be authorized representative in UAE.
Okay.
Okay, just they have their common regulations.
Mm-hmm.
The what we call MOHAP regulations,
Mm-hmm.
Ministry of Health and some welfare.
Okay.
So they can so that, and if you have any representative not as an authorized, you can ask him to get registered. Suppose if you have somebody known,
Mm-hmm.
okay, you can ask them to get registered his firm there. Okay, it doesn't cost much and be a authorized representative because I
Okay.
mean the regulations in some of the countries are not so strict like in
Correct.
Europe or in US. For appointing European authorized representative or for US,
Mm-hmm.
okay, there are a lot of mandatory conditions. Like in Europe, it's all responsibility lies with authorized representative, not with the manufacturer.
Okay.
Okay. So of late, I mean, the responsibilities have become more uh,
Mm.
for authorized representatives, and that's the reason better to have somebody who, or we need to spend some money through some consultancy, big good consultancies like Prayer or some organization, so that we have confidence and trust in them that they are going to execute our duties.
Okay.
Okay, and then we should have an agreement with responsibilities, timelines. Okay, when we are going to get certified, and the important duty of authorized representative is to have a follow-up even after you get certification in that particular country.
Okay.
Follow up in the sense if there are any adverse events or complaints, it will come to the AR, then we need to address them. So
Mm-hmm.
he will be a contact point for us in that particular country.
Okay.
Yeah.
Okay. And sir, what do you think? Like coming down to next 5 years, okay, who will like sticking to a firm will be a better option, or to learn more to join a consulting company? from product to consulting, how will this switch can we make?
See, for some time, I think like it's better to be with a manufacturing organization,
Mm-hmm.
because when you are for some time with a manufacturing organization, you understand the whole system.
Correct.
Okay, from QMS to regulatory to maintenance, R&D, and all that stuff.
Mm-hmm.
Okay, at least you will understand the comprehensive view of it.
Correct.
But when you come to the consultancy, the problem is your job will be very limited.
Mm-hmm.
Okay, only trying to understand and do the documentation work.
Mm-hmm.
But however, I say like when you are in a manufacturing company working with that company, you also can look at, I mean, upgrading yourself, okay, with various regulations that are coming in. Okay, how to go for a global regulatory files. Okay, how to understand these processes and keep upskilling yourself in not only on the quality or regulatory, but also on something which could really add value to your CV.
So because what I see is, uh, in terms of regulatory, there are plenty of things can be done. There are
Yeah.
number countries that we can register the product. There are number of things we can do it. But the only thing when it comes to a manufacturing, there are certain restrictions. For now,
Yes.
they will say, okay, now we will be focusing on only in India. Then we will be focusing on another 5 years. We will move to some other countries, then some other countries. And when it comes to consulting, it is more like how fast we can get the registration, we can get the approval done. What
Yeah,
is
that's what I'm saying, Aman. See, the first 3 years you have to be in manufacturing organization.
Mhm.
Okay, to understand what is this QMS structure or total medical device ecosystem.
Correct.
Then later you can move to, I mean, the area of your interest, like you want to be in consultancy with regulatory or with quality. Okay, and where you will be learning a lot when you come to consultancy in the terms of, okay, catering to various domains or various countries, even include your SOMED or IVDs, okay, or some real medical devices. And you will also have an idea on what total documentation means. Okay, or you can work on some particular documentation of your interest, like on the CE or risk management. You can be expert on that.
Correct.
Okay. So, I mean, my idea is like first couple of years you need to be in an industry to understand it, how the industry works. Okay. And later you can move to some consultancy where you get a very good position to overall look into the total portfolio of the company consultancy, so that you should be a decision maker.
Correct.
Okay,
Correct.
because you need to understand and learn like how various countries regulations look and what is the procedure and the process.
Mhm.
Okay, from the regulatory front. From the quality, I think, I mean, that was the topic today to discuss on QM, quality management system regulations on FDA, and how it is going to merge with 13485, and how you need to be ready. In February first week, they are merging US FDA 21 CFR S20 is going to merge with ISO. Okay, ISO 13485. So that is a very good thing, a very important thing. So your ISO has to have compliance with QMSR, quality management system regulation, and what you need to do for that.
Mhm.
What are the additional documents you need to gather? What is their approach? Okay, how you can plan for your organization so that you will have ISO 13485, including US as one single QMS.
Correct, correct.
Okay, not doing separate files for FDA. So that will become easy for you to have facility registration.
Hmm.
Once your facility registration is done, then there won't be much problem on product registration.
Okay.
Okay, like whether you go for 510K or if you go for PMA. Okay, PMA many people avoid because of the long-term complications with that as a post-marketing approval where you need a lot of clinical data. It's for very high-risk devices.
And sir, like one, I was just because since my total work experience is about 5+ years, and now I wanted to enroll for a long term like a PG post graduation, since I have completed only graduation. So I was looking for some post graduation. So I have two thoughts in mind. Should I get it in India, or should I look for some outside education, or how should I, look this? And specifically, I want to learn in regulatory itself.
Sure.
Okay, this is what I want to, get a professional degree into it. So, what do you say on this, sir?
Since you are already there for 5 years in this industry, I think like you can get your PG regulatory affairs in India. Okay, it doesn't cost you much. If it is only for getting a certificate,
Hmm.
okay. Because I know like a lot of colleges are offering this course full-time, part-time.
Hmm.
Okay, MS in regulatory affairs or uh, some course on regulatory affairs for 1.5, 2 years. If you need, I can get you admissions in some colleges in India.
Hmm.
Okay, which are near to you or where you can. I mean, the only thing is, I mean, for these colleges, perhaps most of the PG colleges who are offering these courses, it's basically a self-learning. There's nothing you have to do, attend the colleges on all this stuff. Only you need to clear the exam.
Correct, correct.
Okay, there you'll get the certification.
Hmm.
Okay, but there are some like in good universities. Okay, they from the government sector, like in the NIPERS or in good universities, like Nirma University or some universities where your attendance is very important.
Hmm.
Okay, uh, and second thing is going abroad for learning regulatory affairs is not. I don't advise because regulatory affairs is not such a technical thing.
Hmm. Okay, okay,
You can learn regulatory affairs from anywhere.
okay, okay.
Okay. If it is something technology, high technology thing or cutting edge technology, which is not available in India,
Hmm.
you can learn it in US where they have the facility.
Okay.
But regulatory affairs as such is not something we need to work in labs or work with high-end machines.
Hmm.
It's only a learning process trying to understand and have clarity of like how you structure your daily work.
Okay,
Okay, trying to understand the regulation. For that, there is no need of going to US.
okay, okay.
And the second thing is just you want to have only certification because you already carry the experience and you want to do self-learning.
Hmm.
Okay, you can get certification from any university, which I will suggest. But still, you want to do after 5 years also. I mean, I still want to learn more. Uh, you can join some colleges, some universities where, but you need to attend.
Hmm.
But overall, what I suggest is you having such an experience.
Hmm.
Okay, if you join any good university or in college or something like a reputed university or in NIPERS like, They will teach you the same thing what you learned in 5 years. Okay, they will tell only the basics. Okay, but I think you know much better than what you will be studying in your PG.
Correct, sir. Actually, the reason why I thought of this uh, was to basically first to get my PG done, to be very clear. Second,
Yeah, that's not difficult, Aman. I'm saying no, you can get your PG done, get your certificate. But as I'm telling, no, in the PG there won't be anything that will be taught new to you.
okay,
It is already what you have learned in last 3 or 5 years. It will be the same thing. Okay, if you want to get into your PG, then do your regulatory affairs with a certification and parallelly start learning more on upskilling, as I said, on something much better than I say not necessarily on AIML, but on more on see that things that are linked to regulatory like these courses offer on medical writing,
okay.
okay, or on clinical writing
Mm-hmm.
or on statistics.
Mm-hmm.
Okay, more towards clinical and risk management. You need to work on getting certifications.
Mm-hmm.
Okay, and the same time learning. It's
Okay.
not a question of certification, learning like in biostatistics. Biostatistics is very important in clinical, like how you calculate the sample sizes, how you arrive at the equivalence or the p-values, probabilities, and all this stuff. Okay, and if you want to do a documentation work more or involve yourself in getting registrations in different countries. Okay, basically you need to do some spade work on. See, the registration structure will be same. I am telling you now. There will be 10-20% difference between countries. That
Okay.
you need to understand what is the gap between gap analysis you need to do between all the countries.
Okay. Okay.
Then how fast you can do documentation.
Hmm. Hmm.
Okay, you can learn. See, this large language models (LLM) we call. Okay, in AI, where I mean it's not that it will do all the documentation and your job is done. You need to give a lot of prompts and feedback to it, and you need to review it, but it will hasten your or it will make your work faster.
Correct. Correct.
From in college, where just you need to clear the exams, I know you can clear the exams easily,
Mm-hmm.
and parallelly do some upskilling on certain important things. I said on medical writing, on CER, or on the risk management, okay, and or on the LLM models that include machine learning, okay. And parallelly, third thing is you continue your job
Mm-hmm.
so that you'll have some money for living or for spending on the fees and other things.
Correct. Correct.
So once you do this for 6 months or 1 year, then you will have an opportunity to get into other companies with a better promotion, better pay scale, or you can move into a consultancy as a regulatory head.
Mm-hmm.
Okay, you need to chalk out what are the activities you will be doing in this 1 year. Okay, I'm getting the PG certification in regulatory. I'm going to get upskilling on certain aspects, two, three things. Okay. And third thing, how I need, it's not only getting certification and this stuff, but how I need to practically have hands-on experience in doing it.
Mm-hmm.
Okay, you need to do 1 or 2 projects to understand that stuff. Okay, suppose I ask you like, can write a risk management file for a dental product or dental level, how you will start and how you will conclude, because that risk management and clinical evaluation are very important files.
Correct. Correct.
Okay, if you work on such critical files and try to link up risk with clinicals, clinical with PMS,
Hmm.
okay, PMS again, all that with the IFU,
Hmm.
and IFU again coming back to the GSPR or General Safety Principles requirements or ERP. In India, we call ERP,
Correct.
essential requirements. How you link it up so that if you do one or files for one or two products,
Hmm.
okay, this will make you very versatile. One thing, then you will have your PG degree, like you will have a promotion, like you are a PG guy. Already you're carrying 5 years experience and you have some upskilling that has happened parallelly on whether whatever choice you have, you can do 2, 3 courses at a time or based on your time. I mean, free time, you can select some good courses from very good universities. Okay, like Indian Statistical Institute is there where you can get Six Sigma, learn Six Sigma or statistics
Hmm.
or some LLM large language models from Great Learning or these are short-term courses like 2, 3 months courses, online courses.
Correct. Correct.
Okay, or join in. I can suggest you some like on medical writing to understand it better and write it better medical writing because it is something which is as you keep learning it will become so natural to you.
Hmm.
Okay, where they won't charge much. All of them are below something like 10,000 for all these courses. So parallelly do upskilling, get your certification and keep doing documentation for 2 or 3 products, full-fledged documentation and try to understand various countries. See, one thing is you need to understand many of the companies either go to Europe or US or their market entry will be basically after India, either it will be Europe or US.
Correct.
This was happening traditionally.
Hmm.
Okay, now the rules have changed. Like people are looking at more countries like in the Latin American countries like in Brazil, Argentina, okay, or Chile, or in these African countries.
Hmm.
Okay, and most importantly, then these countries they are looking at the uh, what you call Middle East countries, like I said, no,
Hmm.
the UAE or in actually UAE is a big market,
Hmm.
or in Saudi. Okay, and they're also moving towards the east, as you have said, on Azerbaijan or Kazakhstan. There are a lot of other countries.
Correct.
Okay,
Correct, sir.
Indonesia, Malaysia, Vietnam.
Vietnam.
Yeah. So I can tell you list of countries where there will be more growth for the organizations, not only just US and Europe.
Hmm.
Okay. These are all developing countries, which I have said. We may not consider Japan, it's very impossible to export our devices.
Hmm.
Maybe we can do something a little bit on China, okay, based on the device cost.
Hmm.
Okay. But you have to look at the East Asian countries or
Hmm.
Indo-Pacific, what we call,
Hmm.
like all these countries, like even Singapore or Eurasian countries, like you said. Ukraine used to be a very big market before the war.
Hmm.
Okay. Like I said, no, Kazakhstan or the whole of the Eurasian continent, even Russia. Okay. Then you need to map it up, like which countries in Europe also you can be very specific.
Okay.
But target, I think the best bet one first will be in the Arabian countries.
Hmm.
Okay, the second is the East Asia, like I said, Malaysia, Vietnam, Singapore, and these countries. Okay, many, I see a lot of companies moving that side. Okay.
Actually, sir, what I see is this small company, like small countries now has more potential, more consumption rate as compared to US and Japan, because US and Japan is overcrowded. First thing, more competition, and more people are there with their products. So getting a market entry is difficult, but once we get a market entry, yes, there is a place for the product. There is a place for there are people to consume. So because of that, now the companies are more focusing on small countries, and
Yeah, small countries for SMEs, like I think we need to look at. Okay, it's not that I am not saying you should exclude Europe, but you should also have priorities for other countries.
correct, correct.
Okay, maybe Europe. The problem with now with Europe is with the UMDR, it has become a risky documentation, and the registration or certification is taking more than 1 year.
Yes, yes,
Okay,
yes.
and lot of money, it's like almost 40-50 lakhs has to be spent for all these economic operators. Like you have authorized representative, you have the only notified body is taking some 20-30 lakhs. Then the authorized representative is taking 10-12 lakhs per year. Okay, then you have the importers, distributors, where you need to pay for them. So the regulatory process totally it is taking, I mean, it is making very costly for the SMEs,
Hmm, hmm, hmm.
and the registration time is taking more.
Hmm.
And as you said, I totally agree with you. There are a lot of players there.
Correct.
Okay, a lot of options, competition is there. But that should also be, I mean, could be a plan B, plan C. But after getting the Indian certification, MDR with CDSCO, we should diversify to these small countries,
Hmm.
growing economies.
Hmm.
Okay, we have Brazil is such a growing economy.
Correct.
Argentina is growing. Chile is growing. I mean, in the Latin American,
Egypt,
of course,
sir.
yeah, of course, Venezuela there is some issue now.
Hmm. Egypt,
Yeah, South Africa is there.
Kazakhstan.
Kazakhstan, yeah, like if you go to Eurasia towards the East Europe, you
Hmm.
have Kazakhstan and a lot of countries like Ukraine is there. I mean, I don't know when the war ends,
Israel,
but
sir.
yeah, Ukraine, like the countries, I can share you a list of 25 countries where there is a lot of potential and growth.
Correct, correct, correct.
Even the East,
Hmm.
Asia Pacific, like, okay. I think Vietnam is a very good market. Malaysia is a very good market. Okay, not Cambodia, but Malaysia, Thailand is a good market. Indonesia is a good market.
So now the Malaysia and Thailand, now they are like mostly the aesthetic products, sir. The laser instruments and those products. If they have a very good potential over there, and
Yeah, yeah.
the companies who are importing it from China or manufacturing it over here. So from here, so they have a good potential over there, sir.
Yeah, you have raised a very good point. Earlier, these countries are getting their products imported from China.
Correct.
Okay, but here, I mean, it could be a very good logical point, not just working on the price or cost of the product less than China or what Chinese people are markets are. We need to bring down the cost. That is not essential. If you provide a very good quality product and have a customer relation,
Hmm, hmm, hmm.
okay, customer relation is very, very important.
Correct.
Okay, and also having a good quality product. I know like Chinese product doesn't have much quality, but if we have our systems developed, providing good quality product, okay, offering them at a competitive price, and importantly, you need to do something extra than what Chinese guys are doing. providing, say, assistance to their, product marketing, customer relations, or on the PMS interaction with their regulatory teams, okay, or
Hmm.
even talking to their doctors, conducting some training sessions there.
Hmm.
Yeah, customer relation, it can last, I know, if the product is of good quality with customer relation, you can have a market for almost like 10 years. That relation will last for 10 years and it will also spread to other countries or other customers. That
Hmm.
I have seen companies like in Ahmedabad where I am working, they have zero, very less, just 5 or 10% of their market in India. Okay, they supply to almost 50 to 60 countries. The total, I think, like 200 crore, okay, market is from other countries. Like what countries I have told. Of
Hmm.
course, they have some market in Europe,
Hmm.
uh, but no market in US. Now they have entered in US.
Okay.
But in all these European, Eurasian countries, actually they had a lot of market in Ukraine
Hmm.
before the war, and mainly that area what you have pointed out uh, before. Once the USSR has divided,
Hmm.
split open USSR. Now it's only Russia.
Correct.
Now the countries which are separated from the USSR are now independent. Like you have Belarus.
Belarus.
Okay, I have that list because we have done it for those countries.
Hmm.
Okay, and if you have some a comfortable, a trustworthy person in the country,
Hmm.
okay, that it will spread, your market will, start growing from year one or year two.
Hmm. No, sir. What I see is, for me, first time, as I've taken first step was my NDR. Second, now I'll be looking for this country specific. Next, I'll move forward for C and then USFDA.
Yeah,
Parallelly,
that's fine.
parallelly. So I don't. I got a very good opportunity today as we had a one-on-one conversation. So if sir can work out on this or one-on-one or anything like that, definitely I'll be very much interested. And if any.
Yeah, let me know. A couple of days before when you have, we can talk one to one.
Mhm.
I can, schedule my time. But what you said is right. Like, so you need to look into these countries, understand their regulatory pathway pattern, what is the documentation required. Mostly, I'm telling you, this is the same documentation what is required for what you do for MDR.
Correct,
Okay,
correct.
yeah, they don't ask much extra,
Mm-hmm.
but we need to have very good clarity on the the pathway of getting it
Correct,
all
correct.
accepted and the regulatory pathway.
Hmm.
Okay, that are very important. And as I said, no, if you have a very good contact, authorized person, authorized representative who also have contacts in that particular country.
Mm-hmm.
Okay, this is another important point. He should not be an standalone guy.
Okay.
He should have a lot of contacts with their hospitals or some appoint distributors there in the country. Okay,
Mm-hmm.
because we can't do it from here.
Correct.
They have to appoint some distributors there so that he manages and you can talk some percentage with him.
Mm-hmm.
Okay, because nobody works confidently and takes so much risk. You can talk on 5-10% for you.
Mm-hmm.
Some partnership, or if your company has, this is the order of the day. Like if it's some shares, or it's like some bonus you can provide if you meet so much of sale and all that stuff. It's
Mm-hmm.
all marketing. Uh, I mean, Marketing tactics. People follow different styles. Okay, to explore what are the first you need to do have marketing intelligence. See like how much of market you can gain. Initially, it could be 10% or 20%. Later on, you can keep on moving and spread to other areas near to that region. Like if you have Kazakhstan, I mean Azerbaijan, you can move to Kazakhstan, Kazakhstan to Belarus, Belarus later to another country. That economic zone you can cover. Okay, Eurasian Economic Union they call. Okay, Eurasian Economic Union.
Okay.
UAUC, EAEC, EAEU they call. So you can spread out there because the regulations will be almost similar. Okay, and everything, even when you talk of converting their some of them in their language, it will be easy because most of them speak the same thing, same language, either Russian or something. Same thing I was talking about in Latin America, the South America or the Latin countries, is they speak morely Portuguese.
Okay.
Okay, that becomes easy for you to go enter Brazil or like Argentina or some countries like even there will be small countries like Peru or Chile.
Okay.
So that's what I mean. The trend is moving now. I mean, you can go to West Asia also. West Asia, like I mean, like I said, no. I mean, Oman is also a very good thing. You after UAE, Saudi, you can enter into Oman. Okay, Iraq is difficult. Iran is difficult. Okay, and start. You can. I mean, after looking at Europe, you can go into other countries. Like in Turkey is a good market actually. Turkey, Qatar. Okay, there you can get registered. Instead of focusing, I mean, this is the what we call the mindset of a lot of people in India that we focus more on Europe. Okay, I do understand why we focus more on Europe. It's like 28 countries, but single registration you can cater to 28, but it's not the same. Today, traditionally it was okay. And the other thing with the Europe is like once you have CE certification, it is the second most valued certificate after I mean the US certification.
Okay.
If you get CE certification, you can sell it just with registration, facility registration in most of the countries earlier. Now every country is asking for their registration and also this their own country certification.
Correct. Correct.
See, I'll tell you like in UAE or Saudi Arabia, these countries earlier 5 years or back, if you look at if we have CE certification, you can sell it in UAE or Saudi or in Oman. Even in India also we used to sell like just with CE certificate.
Correct.
But now the things have changed. They say that you need to get your facility registered in our country, have an authorized representative, okay, and your certification should be from our medical device regulations.
Okay.
Okay, though you have a CE, but it helps you. It doesn't make you, I mean, a direct entry into other markets.
Correct. Correct.
Okay, but earlier, 10 years back, it's like if you have CE, you can enter any market. Even like in India, 10 years back, without IMDR, because that time we don't have regulations.
Yes, yes, because it was followed under pharma segment, na sir?
Yeah, it was under the Drugs and Cosmetics Act, Schedule M.
Yes.
That was it was under pharmaceuticals only. But
Yes.
now medical device became separate. Every country is following the same system like how India has done. They
Correct.
had a separate medical device departments, I mean country wise. They have their own regulations, they have their own rules.
Mm-hmm.
Okay. And in this system of global regulations, I mean, we need to do this. It's not just 510K or US FDA certification, sorry, 510K or CE certification. Uh, with those certifications, you can enter and market everywhere in the world.
Mm-hmm. No, there are things, there are things, and slowly, the regulations are going to be more stringent as compared to earlier, sir. And this is what.
See, I have looked at the regulations in UAE and Saudi. I feel like they are almost similar to that of uh, UMDR.
Hmm.
That's they have that. I mean, like importance or they're so as stringent as UMDR.
Hmm.
So I mean that is very very important. Like when you have something which are regulations which are stringent.
Hmm.
Okay, the I mean the importance of the organization or your importance will become more significant
Hmm.
because you need to do I mean at a documentation at a high level.
Hmm.
So that will be very very important.
Correct.
And I mean I see like you can literally see what will be happening in 2026. I know like see with the I mean I'm not linking it with the US trade or tariffs. Where India is diversifying to other markets, not
Hmm.
in medical device domain, but it also happens in medical device domain that we need to diversify to other markets, not just Europe and US.
Now we have a very good alliance with Russia. We have a very good alliance
Yeah,
with.
Russia you can enter. I said no, another 30 countries where you can enter
Mhm.
apart from Europe and US. If you enter Europe and US, okay, that adds some more market. But should not neglect other 30 countries or 40 countries where still you have a market.
Correct.
Okay, so you need to diversify.
Hmm. Correct, sir.
Okay, once you diversify, one is like you will have some cushioning when you lose market in other countries. Okay,
Hmm.
at least you will have some revenue coming up in other markets if you lose revenue in other country.
Hmm.
Okay, you'll have the basic, you target 100 crores, you'll have that revenue coming in. If Europe and US adds, it may add another 50 crores.
Hmm.
Okay, but your base market will be still there.
Correct.
And of course, base market, talking to India, that should be our base market. You can have 10 or 20 crores of base market here. And looking at other countries which we discussed, another 20-30 crores. Okay, maybe touching 70 or 80. If we go into US and Europe, it may add, I mean, because the value addition will be more in Europe and US compared to, I mean, you see how dollar is, it crossed 90 rupees now.
Correct, sir.
So if you sell one, two products in India and selling one product in US or Europe is same.
Hmm.
Suppose you sell here at 45 rupees or 50 rupees, two products. If you sell the same one product, you'll get that $1, which is equivalent to 90 rupees.
Hmm.
I mean, that's where the difference will be. Uh, I mean, when you look at the US and Europe, but to me, I feel like we should target the growing economies. Okay. all the BRIC countries like Brazil or South Africa, or you can target China also, Russia, India. India is, I mean, India also has very, very good market, and we are 140 crores.
Correct, correct.
And target South Pacific Asian countries. There is a lot of market, like I know. The first best entry will be Vietnam. Okay, then you can go to Indonesia, Malaysia. I mean, in the East, I'm talking. Asia Pacific or in the East. Then you can target Latin American countries. The best will be Brazil. Then I think Argentina could be an ideal place. Then Peru, Chile. Okay, and South Africa also. I mean, if you move to Africa, there are a lot of countries. Actually, pharmaceuticals are doing very well in these countries like South America and so I mean African countries and South American countries. Pharmaceuticals have, I mean, of course, in US also they are doing well. Basically, the generic drugs, not the formulations. The generics are the bulk drugs. APIs are doing very well. Yes, Pranita, are you there?
So actually, pharmaceuticals are more structured, and the existing systems that has been made are more compatible as compared to other things, sir. What I think.
See, the advantage with pharmaceuticals is in India it's well established. We
Yes,
have almost like 30 years of history on pharmaceuticals.
correct.
Okay. I mean, at least 25 history on mainly not on formulations, I say, mainly on the APIs, active pharmaceutical ingredient, mainly the bulk drugs. We are the highest or the largest exporter of bulk drugs.
Correct.
Even compared to China, we export a lot of bulk drugs. Okay, but not the formulations.
Hmm.
But this has been, I mean, very good revolution that happened in pharma sector. And what I'm going to add to this is this revolution is going to happen in medical device sector also. Okay, like how pharma sector has grown from I mean, in early 2000, okay, pharma sector was not doing so great. There are few, I mean, industries like Dr. Reddy's or Nova, basically all of them are MNCs like Panacea or Novartis or Ranbaxy. Okay. But after that, after 2000 or early 2000, a lot of companies have come out like the local, the Indian companies. Basically like Sun or Matrix, a lot of companies like Suban, which are doing a lot of APIs. And my point of contention here is that it happened in medical devices also. A lot of homegrown or Indian grown companies have come out with good quality products, but it took some time. Like say if you look at early 2020 or 2017 and 18, we were having mostly the imports. Okay, 70% of the 70-80% of devices were imports. But now the imports, we are having import substitution, and most of the companies, okay, except on medical equipment, we are self-sufficient to cater to our population. But medical equipment, I know like some companies are entering into medical equipment like on uh, cath lab equipment or MRI or ultrasound, okay, CT machines. All this, I think There's one company which I saw, they have made very affordable. Even IVDs become very affordable in India. And most importantly, one or two companies are entering into robotic surgeries with AIML. Like Merrill has started AIML. Okay, Leela, are you there?
Yes, sir.
So why you joined so late at 8 o'clock?
I went outside actually. So they one emergency work. Then I returned back. I went hospital. One of my teammates joined in hospital.
That's sir.
Mm.
What
So
should
we
we
are mild accident, sir. She met with an accident. So I'm very near to that hospital. So my TL called me and I went there.
Yeah, it's good to help others. I
Mm.
appreciate.
Sir, my side, I need to ask one small question. I don't know it is related or something. In our medical device group, only some poster came, right? Without quality certification, some medical devices are using like that. One photo also uploaded in our group. I don't know it is last week or 2 weeks back or something. One organization is using without certification quality ISO 13485. They are using medical devices like that.
Yeah, many companies are doing that, but in India, anything is possible, but 13485 is mandatory.
Okay.
Even in India also, or it in Europe also. But earlier, I mean, there were some organizations with ISO 9000, they are doing it.
Okay.
But now the regulations have totally changed. Even CDSCO or Indian IMDR or even the Europe, everybody without 13485, you can't manufacture medical devices or even the components.
Okay.
Okay, you can manufacture some raw materials which may not fall, but still you need to have 13485.
Okay.
If they are doing or they are manufacturing without 13485, I mean that's absolutely bizarre. Like, I mean, appropriate action will be taken. 13485 Leela is mandatory.
Okay. Got it.
Okay. So what we'll do is, since I'll be sharing some notes, okay, on MDSAP auditing. However, I'll discuss that with you in the next class. Maybe I'll schedule this class on Tuesday or next Thursday. Anyway, I'll post it in the group. Aman, if you have any questions, you can post it to me. And Leela, you also, if you have any questions, you can call me or post it to me. But
Sure,
since
sir.
it's already 8 o'clock, I'll reschedule today's class because I know like Sunday is busy. I mean, even I don't like working on Sunday. So we'll schedule it some other day in this week. But however, I'll be sharing some notes on MDSAP. And any of you have any doubts, like I'll post it in the group. Any doubts, then I'll get back to you. Fine?
Sure, sir. Sure.
Sure, sir. Sure. Thank you.
Yeah, take care. Bye.
Okay, sir. Take care. Bye-bye.
Have a great
Yeah.
day, sir. Have a great day, team. Thank you.
Yeah, yeah. Take